Welcome back. You're now watching the lifestyle segment of the weekend show brought to you by Holo Crunch.
Crunchy, yummy goodness.
Yum. All right, we'll be discussing the polio-free certification in Nigeria and by and large Africa. The World Health Organization, WHO, has finally declared Nigeria free of the wild polio virus. This feat is coming after 3 years of not recording any outbreak. The official certification for Nigeria was announced by the WHO Regional Director, Mashido Moeto, I feel like I butchered that name, at a virtual meeting hosted from the UN agency's headquarters in Geneva. Nigeria was the only remaining frontier on the African continent with the wild polio virus. The certification of Nigeria also means Africa is polio-free. This is a feat that took years of hard work with huge human and financial costs. The outcome of the collective and consistent efforts of governments, donor agencies, philanthropists, vaccination teams, and global health bodies is what the country is now celebrating. Joining us in today's program to discuss this, we have
Dr. Anis Siddique, who is the Chief Immunization Officer of UNICEF here in Nigeria. Welcome to the Weekend Show.
Thank you.
Dr. Siddique, it's a pleasure having you here. We've had you on the program before virtually, but I'm glad we can now meet in person. Let's briefly discuss how was Nigeria able to attain this polio-free certification?
Of course, I mean, this is a huge public health achievement, and this polio eradication in Nigeria and in Africa. Let me explain how the challenge was. In 1995, when the polio eradication program started, that the National Immunization Day started in Africa, which was kicked off by the great leader Nelson Mandela. During that time, there was an assessment that 75,000 children is suffering paralysis due to polio in a single year. And you know, polio also causes deaths. And we did not have estimation of deaths. So you can imagine how many deaths and how many disability were averted. So, and going forward, every year, those numbers were reversed. And you see, this country is polio-free. The Africa is polio-free. This is huge achievement.
So in 2003, for instance, Kano State and some states in northern Nigeria suspended immunization, and that has been one of the greatest challenges, being able to educate people on immunization. Will you say this is as a success of the Enlightenment campaign, which has been going on over the years when it comes to immunization, or because the cases are gradually just dying down?
Yeah, I mean, this is fact that in 2003 there was a situation and there was an unsubstantiated rumor the vaccine is not safe, and of course the campaign was suspended, and it has been a long way from there. And you know, the principals, the northern traditional leaders, the government officials, you know, they were all knew that these vaccines were safe, but they needed more evidence. The government of Nigeria was quick to contact those you know, leaders to tell that this vaccine is safe. And you know, even the delegations from Nigeria, they traveled to Indonesia, they traveled to European vaccine manufacturers, and they saw in their own eye that the vaccine is procured somewhere in the similar country like Indonesia or somewhere in Europe, where the vaccine manufacturing plant they visited, and they saw that the vaccine manufacturing process is safe, and there is nothing like which is forbidden materials inside the vaccine. So they came back, and I remember and last 2 days back there was a traditional leader who himself told that he ingested all the full vial of the vaccine to show that this vaccine is safe. And you know, I would like to congratulate this government of Nigeria that bold step was taken during that time, and then the government official at the state level, and particularly the traditional leaders, they did an amazing job in Nigeria. Without them, it won't be possible in Nigeria. What we achieve today. Look at the other country. There are at least 2 other countries. They are not close to Nigeria, what Nigeria has achieved. So I see this as a big achievement.
But moving forward with the whole, hoopla of, the COVID-19 vaccine is targeted at setting demographic, it's targeted against black people. As head of immunization at UNICEF, how are you going to go about debunking these sort of rumors? Because as we see, proper immunization was what helped Nigeria become polio free. So how would you go about that campaign in sensitizing the public regarding the importance of immunization?
I see, the COVID-19 is a crisis. But, in a public health standpoint, I see this crisis even an opportunity for us. How? First and foremost, we have an evidence that the vaccine works. And you see that the polio vaccine, which you deliver, even the farthest corner of Nigeria, even every 60 million children were vaccinated one single day. And it goes house to house. The vaccinators are going house to house. So this evidence is at the doorstep level. Everybody knows that the polio vaccine worked and polio was eradicated. Now, you also know that when this COVID-19 pandemic started, everybody is looking for a remedy. What is the remedy? So there are two remedies. One is that prevention, and as we know, the prevention is the best cure. But as an immunization person, I see that from every corner in the world, everybody is eagerly waiting when the vaccine would come. So the demand for vaccine is the highest at the moment, and particularly when it comes to the COVID-19 vaccine. So I see that there is a huge demand for COVID-19 vaccine when it comes. And I see that the strategy we used for polio, for example, we have the robust microplans. Like this microplans is telling that which corner of Nigeria is hardest reach area and how many children is living there. So we have that microplan. We have the vaccine tracking system. So over the years, the millions of vaccinators visited all the houses. So we have a vaccine tracking system. So we know that where the pathway to reach out those households. So that you have a proper system in place. Then we have a technology, and we have the human resources to deliver this vaccine. And I'm telling you one thing, that during COVID-19, all the international flights were closed, and the Nigerian airspace was closed. But we were able to charter flight. We were able to import all the vaccine in Nigeria, and UNICEF ensure with the support from government that all vaccines are there.
Sorry to interject. I think you missed my question. So there are rumors by very prominent people in society regarding the COVID-19 vaccination. There are crazy rumors about implanting people with a microchip, and it's the sign of the devil. We actually had a very famous pastor go on national television and say that. So how are you going to go about the sensitization of the public that the vaccine is actually a way to mitigate the negative effects of the COVID-19 virus?
Well, we have very good communication strategy, which I have been mentioning. That strategy is talking about the vaccine, starting from the vaccine manufacture process and how it works, and how vaccine is given and how it works with the human body. And then we have the examples from other vaccination process. And as I mentioned about polio, so these are the examples, like how we can mitigate those rumors. And of course, the community engagement process, the traditional leaders who has been very, very effective, reaching out through this the grassroots and community level structures such as Mayangwai or Bulama, those who are going house to house and ensuring that these vaccines and the messages to the household level is clear. But as you know that we have been dealing with the anti-vaccine rumors for years, and there are evidence even with the developed country. There is anti-vaccine rumors, and people are not coming, and the children are not coming. There are excuses, and we saw that there is always outbreak when the system fails. Then there is an outbreak. But as I said, that the COVID-19 vaccine demand is high. So we would like to see that opportunity that maybe one pasture or one group of people is talking about anti-vaccine elements, but we have the millions of people who are pro-vaccine, and we want to use the power of those pro-vaccines messages, pro-vaccinators, and also like the message and messenger both works together. And I hope that we will be able to overcome those, and debunking all these rumors. And I'm hopeful because we have experience.
Talking about strategy, yes, we're glad that Nigeria and Africa is now polio-free, but two countries, like you said, Afghanistan and Pakistan, they still have cases of polio. Now, international flights will be started or reopened on the 5th of September in Nigeria. How communicable is polio, and is there a chance of it resurfacing now that movements may be more open internationally, besides the contaminated water, which is a problem? What's the possibility of this endemic reoccurring?
I think I appreciate your question. It's really very important issues. There are two countries are endemic, and they even could not stop the transmission. This is active transmission going on. And the virus doesn't require any passport and visa. I mean, it can travel, and you say is waterborne. And another difficulty is that this polio virus is affecting children, but the adults are carrier. So, and the biggest challenge is that I see, of course, you say that travels is the one mode. The another indirect one is that the pilgrimage takes place, like where people from Nigeria or the other two countries where the polio is endemic, Pakistan and Afghanistan, they might be having the similar congregation somewhere, and there might be situation that the adults are carrying virus inside Nigeria. So there are a few way to deal with that, and the first approach is that strictly following the international health regulation, and it says that anyone traveling those countries and anyone traveling from those countries inside Nigeria should have polio vaccination, and they should show the vaccination card. Otherwise, probably the Nigerian authority has the system in place that their visa will not be issued or something like that. Okay. The second issue is that we can imagine a situation that the virus may come inside Nigeria. So we have to continue the vaccination. Remember, the polio eradication is a global term. So if Nigeria eliminated polio, but the polio is not eradicated from the earth. So until and unless one single virus is in the earth, then the eradication process is not completed. So what we need to do, we need to give polio vaccine through routine immunization system. So when a newborn is given vaccine, polio vaccine just after birth, and then we give OPV 1, 2, 3, and also we are also giving injectable IPV, which is one very important tool, and we should use those opportunities so that we ensure vaccination is high and every children is protected, and time to time we would have polio vaccination campaign so that the mass children are vaccinated. So this is the way we can protect our children, and we can stop any importation in Nigeria.
Awesome. I believe we have Yusuf Tanko SUNUNU, Chairman House Committee on Primary Health, on the phone. Are you there? All right, the director said we're still trying to reach him. Okay, so you've clearly expressed or you've clearly elucidated ways that we can stop the reimportation of the polio virus. So what does the Nigerian government, you spoke briefly about that in checkmating these health issues at our borders, but what else can the Nigerian government, bringing it home now, do to ensure that we're protected and we remain polio-free?
Yeah, I think as I mentioned, the whole process is that you ensure vaccination process, ensuring the vaccine supply is uninterrupted. The whole polio vaccination in the hard to reach area, particularly in the northeast region, where access is a problem, we continue vaccinating children there, and also we strengthen routine immunization system, and ensuring the infrastructure and building the immunity, and also you see that a lot of children are under malnourished. So even you give vaccine that it may not be working properly. So we need to ensure the vaccination, nutrition status, like the primary healthcare system in place, and so it's a holistic approach. So we need to develop a enabling environment for healthy children and healthy environment, primary healthcare system, and both supply and demand in place. So this is the way like we can maintain the polio-free status in coming years.
Honorable Tanko, are you there?
Yeah, I'm there. I'm listening for you.
Hello?
Hello, good
Yeah,
morning.
I can hear you. I can hear you. Yeah, I'm hearing you.
Okay, good morning, Honorable Tanko, Chairman House Committee on Primary Health. Can you talk to us more? I asked Dr. Siddique earlier to walk us through the process of Nigeria becoming polio-free. Can you tell us some specifics?
Yeah, good morning.
Good morning. Can you tell us some specific steps taken by the Nigerian government in achieving this? And what challenges you faced on the way?
Thank you very much for inviting me this morning to participate in this very important deliberation. So, let me start by congratulating President Muhammad Buhari and the entire Nigerian population for this milestone achieved. That today we are in a country that is certified as a polio-free country. This is a milestone achievement, and I congratulate Nigeria, Mr. President, Nigerian government, the development partners, and all the stakeholders, and also I congratulate the families of those who lost their loved ones during this international global struggle. Nigeria reached this milestone through commitment, dedication, and continuity, and I think that we have another lesson to drive in these milestones that we have so far achieved. Polio eradication is one of the program of government that has seen a collective and concerted effort. Major stakeholders were identified, ranging from religious traditional groups and also the governmental and partners that are supposed to key into the programs. And Nigeria also demonstrated ability to ask partners to key into its own programs so that we can achieve a success. So that in the end, the whole program become owned by Nigerians and is driven by Nigerian goal to eradicate polio. And secondly, we also seen a lot of commitment in terms of funding of eradication of polio. We did not only rely on the international funding, but we have also geared toward improving domestic funding of polio eradication. And this is one of the areas that even at the National Assembly is one of the budget lines that as proposed by the executive, that is how it goes to the implementation, so that there's no penny that is touched in terms of trying to adjust or make a contribution. So this has made a lot of funding possible for that. And not only that, we also, the country also dedicated times towards health education in terms of providing people to know why polio is a burden to the country. It has an economic impact, it has security impact, and it's also, if we are not committed toward eradication, the country will also be isolated. So this put together made Nigeria to reach a milestone that today we are all here together celebrating. Most importantly, for me, I think what is most needed now is to see how we can also get toward not only maintaining Nigeria to be a country that is free of polio. And this also requires further investment to ensure that we have incorporated fully the polio vaccination in our routine immunizations, and we must also ensure that our sources of vaccine are not only effective but also I want also here we have to also look at the possibility of Nigeria diversifying so that we can also locally produce vaccine against polio, because if we do that, that will reduce our spending outside and will empower our people also to work. And majorly also, we must also look to another direction now in terms of rehabilitation. We have so many people that are incapacitated by polio currently in the country. Those people must be identified, and let us see how we can rehabilitate them and make them to be not a liability to the nation, but they can stand on their own so that they should be supported. And this is bringing it to the fore. It might be just coincidence that the President Buhari has just approved a commission that can take care of the disabled persons. And most of these disabled persons are affected or affected by polio. So I think they should be given a very good position so that they can be rehabilitated. When we now have a pace of rehabilitation, and I think that's where we should move. So for me, I see we must strain through active funding, incorporation of polio into our routine immunization, and rehabilitation of those that are affected.
Honorable SUNUNU, just before we let you go, a lot of this success is as a result of support by private and international donors. What, in your capacity as the chairman of this committee, are we doing to ensure that we can have a sustainable solution which is domesticated here in and by Nigeria, especially when it comes to research, when it comes to such situations? What are we doing to ensure that we can be self-sustainable with these solutions as Nigeria?
Well, first of all, I must thank you for this very important insight question. What we need to do now is for Nigerians to believe in ourselves, that we can do it for ourselves. I'm one of the people that actually always is promoting domestic source of funding of healthcare delivery services. We cannot continue to be depending on international organizations. We have seen right now that the world itself, each and every country is diverting its own resources to self-isolate itself so that it can take care of the needs of its own citizens, especially during this COVID-19 pandemic. So this is a great lesson that we also have our own plan A, so that we can look at the domestic external funding as plan B. So we must now look at alternative sources of funding of healthcare in the country, so that everyone will be able to be secure that he can access free or he can access healthcare in the country. And what are those alternative sources for us to ensure that we intend to celebrate without overspending on foreign funding? We must look at the area of leakages through a very good oversight function of the National Assembly. There are areas of leakages that we must be able to block so that we reduce wastages. We must also look at how we can generate our internally generated, how can we improve our internally generated revenue, and we must ensure that also NGOs that are generating internal revenues are also repeating exactly what you're supposed to do to the federal government of this. So that in the end, for us to send this game, we must ensure to work closely towards achieving what was signed in Nigeria, that is the Abuja Declaration, of at least Nigeria allocating at least 15% of its consolidated revenue to healthcare. And when we do that, we have enough of resources that we can now say we can build a healthcare that can stand on its own. It also reiterate what we have what I've mentioned in the video last time. We have learned lesson, and I hope we are going to work that lesson. We are in a situation in the last 4 months. If you have or you don't have, almost the same as calling, because you cannot go out of the country to seek for healthcare needs. So it means we must remain in this country and work together to ensure that we strengthen the system so that we can achieve what can be a sustainable healthcare that will ensure health within the country.
That's a fine place to leave it. Thank you so much, Dr. Yusuf Tanko, Chairman, House Committee on Public Health. Thank you, Dr. Anis Siddique, for your time, Head of Immunization at UNICEF. We'll take a short break right now. When we return, more on the Weekend Show. Don't go anywhere.